I'd like to share a snapshot of what's happening across the UK right now with regards to systems approaches to obesity prevention. At the nub of it, as you all know, obesity is not a simple problem. It's not just about willpower or calories. It's tied to how our environments are built, how our economies work, and how our communities are structured. Over the last decade or so, we've moved away from isolated efforts to try and get individuals to change their behaviours, and now we're seeing something a little bit different. We're seeing local areas bringing multiple sectors together to try and coordinate their efforts. I guess the question that remains is how far has this shift actually happened, and what does this type of work look like on the ground? So if we kind of just peel back some of the layers to this and we look at, what's the background context leading to the use of systems approaches in the UK? So systems approaches have become widely recommended in public health for good reasons. The idea is quite straightforward on paper. Instead of focusing on trying to fix individuals, systems approaches help them to understand the systems and conditions around them and what it is that's actually driving the problem. So here's what it does. They help a group of stakeholders to see how their local system operates. It then helps them to identify where they collectively can intervene. And I think at the heart of this, it's very much trying to shift work away from isolated efforts of individual sectors and individual organisations into collective action, where each organisation, each sector knows how and why what they're all doing. The next couple of slides show what this might look like a little bit in practice. So each green dot on this slide represents an individual action or an intervention. Historically, most of those actions will have been at the individual level behaviour change type interventions, funded or implemented by public health teams. They were often really fragmented and isolated interventions. When we move into what this might look like through the lens of a systems approach, it looks slightly different. So we start to see more coordinated and multi-sectoral action. Each sector, say housing, health, education, business, transport, used to work separately, whereas now, through a systems approach, they're recognising that they need to work together. One action can help try and address multiple problems at once. And this is very much a paradigm shift in terms of how we think and work. So actions are working systemically to address the root causes of a problem rather than reacting to issues as they emerge. In order to help support local public health teams to do this type of work, Public Health England from 2015 to 2019 commissioned Leeds Beckett University to develop and test a whole systems approach to obesity guide. What that resulted in is a 6-phase process for local areas to come together, to map their local system, to understand who's involved and who's not, to identify where they can collectively intervene, and how to coordinate action. In terms of what we knew about this process, as of about 2023, we knew that it had been downloaded over 60,000 times. We knew it had been adapted across Wales, Scotland and Northern Ireland. And anecdotally, we estimated that about half of England's local public health teams were using it. But there was a heck of a lot that we didn't know. We didn't know what those approaches actually looked like in practice. We didn't know the extent to which they were working. And so in order to try and address that, we recently sent out a survey to local public health teams in order to find that out. So as part of this survey, we had 4 main aims. The first one was to try and determine how widely systems approaches are being used to support the healthy weight agenda in the UK. We then wanted to understand, from a fairly superficial level, what those approaches look like in practice. We wanted to learn about what are the barriers and the facilitators facing their implementation. And then we also wanted to identify future support requirements for those who are designing and implementing systems approaches. To do this, we co-designed a 41-item survey with local public health practitioners across all of the 4 UK nations. We worked with the likes of the Association for Directors of Public Health, the Royal Society for Public Health, Food Active, and other organisations to really disseminate this as extensively as possible and through as many channels as possible to reach public health teams. So between April and October 2024, we reached all 185 local public health teams across the UK through at least one of those approaches that I was speaking about beforehand. Moving then into, well, what do we find from this particular survey? So the first question, how widely are these systems approaches being applied in the UK? We had 70 responses in total. 59 of those local public health teams considered themselves to be implementing a systems approach. So that's quite significant. It's real. It shows that these systems approaches are happening at scale across the UK in the context of the Healthy Weight agenda. And we had a pretty good spread across all of the 4 nations in terms of response rate. So we had 45 responses from England, 5 from Wales, 6 from Scotland, and 3 from Northern Ireland. And when we look at the years in which they commenced, we had a roughly even split between 2019 to 21 and 2022 to 24, but about half of them started after 2022. Moving then into what they look like, as I say, at a fairly high level in practice. So on average, each of these approaches brings together 12 different sectors, be that from parks and leisure, community organisations, children's services, hospitals, health services, planning and schools. All of the approaches were being led by public health teams. About 73% of those were using the Public Health England guidance. The 25-ish% that weren't were drawing upon things like the Healthy Weight Declaration in order to secure the buy-in for the implementation of a systems approach. Coordinating teams were typically made up of about 4 people on average, putting around about 49 hours per month collectively into driving this work forwards. But interesting, when we looked at ring-fence funding, who received training and evaluation, only 51% of public health teams had received any formal training in how to implement a systems approach. Less than a third had ring-fence funding to support the implementation, and about 4 in 10 of those systems approaches were being formally evaluated. So on the whole, there's a real commitment to this way of working, but there's rarely any additional resource being put into this. So people are having to reshape existing resources in order to take forward these newer ways of thinking and working. When we look then at how these approaches have been intentionally designed to address multiple issues at once, what we found was that about 78% were aligned with the physical activity work, 73% with work around food insecurity, 6 in 10 aligned around the poverty agenda, just a bit less with regards to the cost of living crises, and then just over half aligned with the infant feeding agenda, and just less than half aligned with the mental health agenda. So this snapshot here is really showing that these types of approaches can help to address and tackle multiple problems at once. So it's showing partners how the healthy weight work fits into the work that might already be ongoing by other partners across local areas. I realise that this is quite a complicated slide, but what we tried to do within the survey was understand a bit more about the 10 core conditions that show whether a systems approach is developing well. So those conditions include things like understanding that obesity is something with interconnected causes and it's a complex problem. It delves into whether or not true collaboration is happening across sectors, the extent to which people are building skills and knowledge in the use of systems approaches, how the public are being meaningfully involved, whether or not the approach is flexible and able to adapt to the local context. And then lastly, it's about one of those last conditions is about evaluating what's working and whether or not we're learning from that as we move forward. So most teams on the whole had much higher maturity around their understandings of complexity, and that's shown at the top of this chart here. But as we filter down through it, there are some pretty big gaps elsewhere, but this aligns to what we've heard previously in this presentation. So one of the big gaps is in their maturity around evaluating systems approaches and how to embed cycles of learning. There seems to be a significant area of underdevelopment with how to engage and work with local people as part of a systems approach. And one of the biggest gaps is how to create agile and proportionate governance to support the design, implementation, and evaluation of these systems approaches over time. So moving finally into the last two aims then of this work in terms of, well, what's helped and what's hindered the implementation of local systems approaches, and what's required to support them as we go forwards into the future. So in terms of what helps, we've seen across the board that senior leadership support is absolutely fundamental. It's not just about having a leader's name on a particular document, it's about them actively unlocking time, protecting resource, and signalling across the local area that this type of work really matters. When an approach seems to have lost momentum, teams mentioned one thing consistently, and it was about a change in leadership. So these joined up efforts are really fragile without that sort of protection and support from the top. In terms of what we saw hindering systems approaches, three main barriers kept coming up, and lots of those were interconnected. There's often not enough capacity in terms of time and people to set this up, run it, and evaluate it. Linked to that, there's very rarely enough funding to do this work in a meaningful manner. And there's also a lot of competing priorities in the local area that can quite often make it hard to prioritize the systems approach in the healthy weight space. There's also another barrier, which is about mindset. There's a history and a bias towards working at the level of individual behavior change, and a systems approach really represents something a little bit different about what's causing the problem and where to intervene. And that changing thinking and changing working is really difficult to start to shift. We also recognise that there were some differences in what we heard based upon whether they were of, a higher maturity or a lower maturity. So those more mature approaches, to the left-hand side of the screen, were typically struggling to maintain the momentum of their systems approach without having dedicated funding. When we looked more to the right, we saw that those less mature approaches needed to have the protected time and dedicated resource in order to get this going. And they also needed to have a clearer understanding of their role at an organisational and sectoral level and how they then fit into these approaches going forwards. Now, regardless of maturity, three things came through. The first, as I mentioned earlier on, was about senior leadership support being absolutely critical. The second is about governance structures, setting those up, and that historically they haven't always been flexible enough to truly support a systems approach to work. And also the amount of time that's required to try and build genuine cross-sector relationships and working. And then finally moving into, well, what's needed to go forward? The teams that responded to the survey were all pretty clear. So across all of the approaches, regardless of their maturity, they often called for support on how to evaluate their approaches and guidance to support that. So we're talking about simple frameworks and not overly complicated methodologies. And they also called for national support and more coherent signalling that this type of work really matters. In terms of the less mature approaches, interestingly, they were requesting more of a community of practice, so a place to share what's working, what's not working as well as might have been hoped for. And then those more established or mature approaches, they wanted better examples of, well, what does good look like in different contexts? And they also wanted real evidence as to whether this way of working actually changes outcomes and changes the conditions that their communities are living within. So just to bring this to a close, there are 5 key points I think to take away from this presentation. The first is how important cross-sectoral senior leadership is. It seems to be like one of the biggest differences between stalling and developing in the design and implementation of a systems approach. The second is about that multiple sectors and agendas can be aligned. So partners can start to see their place in the system and how all of that works collectively. Public involvement is definitely something that has come through in several places as requiring more support and more resource. Evaluation, similarly, and learning also needs more support and more emphasis. It's difficult to try and understand what's working, what's not, and how and why if we are not evaluating these approaches in a meaningful way. And then lastly, and more of a reflection, I think, from our team is that it seems like the guidance, such as the PHE toolkit or the Healthy Weight Declaration, can help start these approaches, but the case studies and the evidence are really required to show how do we sustain these and maintain these as we go forward. So teams are needing proof of impact and examples in order to learn from. So the landscape does seem to be changing. There is clear buy-in and operationalization of these systems approaches. There's multi-sectoral coordinated work happening. I think the next question is, how do we help this to happen more at scale? And crucially, how can we measure and evaluate whether or not it's actually leading to improved conditions and places for people to live in? Thank you.